Hello everyone, and welcome to the East Brunswick Advisory Health Council's Wellness Spotlight. There are so many advantages to living in the township of East Brunswick, and one of them is the East Brunswick Public Library. Today, I'm with Karen Parry, the Director of Information Services for the East Brunswick Public Library, that's going to be sharing some very important information for us today. Karen, welcome to the Wellness Spotlight.
Thank you, Dr. Freedman, for inviting me.
Karen, let's talk about libraries in general. It seems like, especially with our library, there's been a shift in the library being just a place where people could go and get books or read or study to really being a community resource center. Can you talk a little bit about that?
Sure. Libraries have always been places where people turn to for information. And right now, there's a big boom in the healthcare landscape. The healthcare landscape is changing from what was once a 129-year-old model of treating people once they're sick. Now the model is keeping people healthy, keeping them out of the doctor's office, reducing costs. In fact, I read something very interesting the other day that said that in 2015, the United States spent $10,000 per person on health care. We spend more than the 12 most industrialized nations on health care. So health literacy is a booming area right now, Dr. Freedman. In fact, so much so that our hospitals are looking at libraries. They're looking at engaging libraries as community centers, hubs where people can go for information about staying healthy, living their optimum life. And for those of you for whom health literacy is not a familiar term, health literacy is defined as the ability to obtain, understand, and act on health information and obtain appropriate services so that people can reach their maximum health. So our library has started this initiative called Just for the Health of It back in 2010. It has since expanded, which we are very proud of. In fact, so much so we have been written about in Library Journal, which is an international library magazine read by academic libraries, hospital libraries, public libraries. I gave a presentation last January to the Health Advisory Board of the Philadelphia Public Library System, which is 30 libraries, who has since modeled our Just for the Health of It health literacy program.
Well, congratulations, Karen. You and your team had a lot to do with this, I guess, right?
Well, yes, we did. It actually had a somewhat of a unfortunate and tragic beginning, but it had a very happy ending to our health initiative. Back in 2003 was the first time I became exposed to health information when my mother was diagnosed with a very rare brain tumor. And this was my first time in being what I call patient side of needing health information. And at that time, I was scouring the internet. My siblings were scouring the internet, trying to find information to understand her condition. And I became so overwhelmed and frustrated because I didn't know how and where and how to really understand, decipher the best information. Right after that, my own sister was diagnosed with breast cancer, and once again, I found myself back on the internet, overwhelmed with information about breast cancer and how to evaluate information. So what happened is we started a small health initiative that actually grew out of that. After those two tragic events, over the years, the demographics of East Brunswick began to change. We began to see more and more people come to our reference desk, people that were new to the community, people that we had many new immigrants coming. We had an aging population. We are demographically an aging community. And I noticed a trend, and the trend was that many of them had health and wellness questions, and they turned to the public library. And everything from the past few years led up to that, that there was definitely a need for health information. So we started a very small initiative in a corner of the library, what I call a comfy corner of the library. We had just a small assortment of books. It was very focused on disease at the time. And it has since grown, has been embraced by our hospitals. As I said, Philadelphia Public Library is now modeling it, our program in their, and they even opened up a consumer health branch in the Philadelphia CHOP division, the Children's Hospital of Philadelphia, where librarians are trained to help people find health and wellness information. And I emphasize the wellness because right now, the shift, as I said, it is on keeping people, and no one would know better than you, Dr. Freedman, how important controlling costs are. The healthcare system, the hospitals are merging, doctors have pressure on them now, not for number of procedures, but for outcomes. So there is a lot of pressure to keep the costs down in healthcare. So we are very focused on helping people find high quality, reliable health and wellness information so that they can reduce the number of doctor visits. Hospitals are very intent on keeping people out of the hospitals, especially within the first 30 days because they get fined. So what better place in the public library where people turn to us if they have a need to understand a condition so that they can reach their optimum health, even if they have a chronic condition such as type 2 diabetes. Something like type 2 diabetes where they need to understand lifestyle, the importance of exercise, diet, things like obesity, keeping people healthy, so they maintain healthy weight, keep it so that they can not become type 2 diabetic in the first place. Keeping people, helping people understand the importance of exercise so that they don't become obese, they don't develop hypertension. We get, last year we got probably close to 3,000 questions from our community on all areas of health and wellness. So this is a very important area right now for the healthcare community.
It's interesting, Karen, because with such a diverse population and East Brunswick being known for a place where there's so many doctors that live and practice here, in so many specialties, in so many different areas, why would it be necessary for people to come to the library to get health questions answered? Why wouldn't they just go and speak to their doctors?
Well, that's a very good question, Dr. Freedman, and the reason is because the average doctor visit right now is 15 minutes. And doctors are busy, and people, many times they'll come right from the doctor's office to the library and they'll say, the doctor says I have this. And it is amazing, people, even if they ask a question, sometimes in the interaction with a doctor, people don't hear also. That's why it's always good to bring a family member. But there is a need, in order to really achieve optimum health outcomes, people need to understand their condition. They need to understand why the doctor told them to do something. They need to understand their medication, why it's important to take it, why it's important to take it when the doctor said they should take it. If they don't follow the protocol, what will happen to them? These are all things that translate directly into lower health care costs. People not having to go back to the doctor, not getting admitted into the hospital because they didn't understand why it was important, if they had type 2 diabetes, to follow that protocol.
Now, we want to be very clear to our viewers that it's not the intention of this program to diagnose conditions or give health care or disease care information to people for them to practice. It's really for people to get additional information that they're interested in and then go to speak to their doctor about it if they have further questions.
That's so important. And of course, our librarians, we are part of the National Network of Libraries of Medicine. They do get training in all areas of consumer health.
These are consumer health librarians.
Consumer health librarians. However, we never diagnose. And people will come to us and we will help people. Someone says, I have this problem. We will always help them find the appropriate specialist in their area. This is a literacy program, and I emphasize literacy. It is a program to help people understand their condition, not to diagnose their condition. We respect the medical community and we work closely. But again, I want to emphasize that we are very focused on wellness. We are really focused on keeping people healthy. We don't just get disease questions. We get a lot of people that want to know about the benefits of Reiki, about what yoga can do for them. They have arthritis. Will swimming help their neck arthritis? Where can they find a fitness center that can that's close to their home, and they'll tell us where they live. Those are the kind of things that we get a lot of questions on nutrition. It's probably one of our most important questions. These are all things that are really key to what I call the new era of health and wholeness.
Well, you're really preaching to the choir, Karen.
Oh, I know I am.
The whole purpose of Wellness Spotlight was not to give people disease information, because there's plenty of information about treating diseases that are out there.
Right.
But there isn't really a lot of information out there about what people can do to become and remain healthier.
Exactly. And I think it's a wonderful opportunity for people to use their public library as a resource for health and wholeness information, to stay healthy, to avert disease, because many diseases can be avoided, and the library is a wonderful resource.
Now, when somebody has an issue that they want to investigate, do they need to make an appointment with the consumer health librarian, or can they just come in?
They can just come in. And to the information desk, and not all of our librarians are trained through the National Library of Medicine. Only certain ones of them. They take ongoing training in East Brunswick in all areas of teen health, senior health, nutrition, clinical trials. Every month the National Library of Medicine is giving different programs, a lot of health and a lot of wellness topics. But they can just come in and meet with the librarian, or they can make an appointment. We always do interview people in privacy, because of the need for privacy regarding health information.
HIPAA guidelines, yes.
Exactly, for HIPAA guidelines.
And in addition to the section in the library where people can get books and literature, and where they can go online, you also offer information in the library's website.
We do. We have a website called welllinks.org, www.welllinks.org. It has links to finding health and wellness information. We encourage our community to visit there. We actually get about 1,500 to 2,000 visits a month on the website. So that's another resource funded through the National Libraries of Medicine. But again, I want to emphasize, libraries here to keep our community healthy, and there's nothing better than a healthy community. East Brunswick is interestingly an aging community. People are getting older. You can stand in the library, Dr. Freedman. You could see people walk in their 60s, 70s. They are interested in health. They are interested in staying vital and active and keeping their minds active, and they want to know about how to avoid dementia and all kinds of wellness topics. So the library is a really strong resource to help our community, and that's why it is, healthy communities, we're only as good as the health of our communities.
How many people would you say utilize these services right now, Karen, and does the library have a goal going forward?
We have, like I said, we probably do around, I think last year we reported around 3,000 requests, close to 3,000. We do get a lot. We get about 1,500 to 2,000 a month through our website as well, where people will actually go on the website to look for health information, so we track those numbers. People can also submit a request through our website to a consumer health librarian.
I also understand that other libraries in other communities around East Brunswick refer people with health questions over to the East Brunswick Public Library because we're so well staffed and we have such great information, and they don't.
They do, and the hospitals right now have a 3-year community health improvement plan. One of the initiatives is to engage more public libraries to provide health information. Health has not always been in the purview of public libraries, something that they focused on. But it is something, again, the wellness emphasis is really something important. The hospitals realize that good health starts in the community, and they're looking at public libraries as channels, very effective channels to reach a lot of the constituents before they end up in the emergency room, before they end up in the doctor's office. So they don't want to basically see people, they want people to stay healthy.
You know, you haven't spoken yet about the programs that the library offers also on health and wellness. Could you take a few minutes and talk about that, Karen?
We do. We actually have, I'm very happy, we now have a full-time consumer health librarian. I have 5 part-time consumer health librarians, but 1 full-time librarian, Kathy Churn, who now is doing, we're doing 1 to 2 health programs a month. We're going to be doing one on Reiki in a couple of months. We just did one on Medicare. We did one, he had a gastroenterologist a couple of weeks ago. We're always trying to find something for health. We had medical students here. We've had Rutgers pharmacy students here. It was actually a wonderful, it was a perfect day because we had a senior movie that day. And right when the movie ended, all of the seniors came out and the pharmacy students were there, and they had little games about medication, how to take your medication, how to store your medication. Of course, the students got credit for that. We had medical students here one day practicing speaking to their future patients. So yeah, so it's been quite a lot of fun.
Well, the word doctor really means teacher. And unfortunately, with how managed care has gone these days, most doctors have moved from service to volume by necessity. So it's great that the East Brunswick Public Library has really taken the responsibility to serve our community so well, to provide this type of excellent information and to do it in such a professional way, Karen.
Well, thank you very much, Dr. Freedman. I just want to emphasize to our community, this is a literacy program. It is a program to keep our communities healthy and well, to understand how to live their best life possible. So it is really an honor for the library to play such a major role. So thank you so much for inviting me.
Oh, you're welcome, Karen. It's a pleasure always. Karen Parry, the Manager of Information Services at the East Brunswick Public Library, thank you so much for taking time out of your schedule so that you could be on Wellness Spotlight today to tell us about the Just for the Health of It section and the services that you provide the community. And I also want to acknowledge you and all of the staff at the East Brunswick Public Library for working so hard to help us.
Thank you so much, Dr. Freedman.
Thank you. This concludes another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. I'm Dr. Ken Freedman, here today with Karen Parry, reminding you that wellness works when you work it.